This is one of the most important questions in all of facial plastic surgery.
So when is the best time? Is it in your 40s? Is it in your 50s? Is it in your 60s?
People can have 10 vials of filler in and they may look pretty good, but they may look different. Look, you could do a facelift at 80 and live to 100 and feel like you had a better neck for 20 years. So I don't know about your mental state, but physically, yes, physically you're a good candidate. Yeah, you're
UnPhiltered.
You're healthy, you're lean, and your anatomy looks like it'd be easy to reposition. Hi there, it's Dr. Phil Solomon. I want to welcome you back to UnPhiltered, our podcast series to talk in an unfiltered manner about facial plastic surgery. Today we're going to touch on a few topics, including getting real about facelift surgery. How do you pick and set yourself up for a successful facelift operation? 2, we're going to go over some FAQ questions that we commonly get regarding rhinoplasty. We're going to talk a little bit about energy devices, from lasers to microneedling, and maybe some other miscellaneous stuff. And so I'll turn our attention over to Nancy.
Hi, everyone. So today we're going to talk about how to get the best facelift surgery results, have the best experience, and it all starts with choosing your surgeon. So how do you choose your surgeon? What do you search in Google, and what do you look for? So Dr. Solomon, maybe you can shed some light.
Well, I think in general, when you're picking a surgeon, it's tricky. You know, if you have a friend or a family member who already has a relationship with someone and has a good result from a procedure, obviously that's probably one of the most comforting things, because you actually have a connection. But if you don't have a connection, you're doing research, I think it's important that you look for a surgeon who's offering the procedure that you're looking for and does it in a regular, frequent manner. So for instance, like rhinoplasty is a very complicated procedure, and you don't want to see someone who does the odd rhinoplasty. Say, for instance, someone who does predominantly breast surgery, who does like one nose a year, maybe not be the ideal person to see for a complex revision rhinoplasty. So seek out someone who does the procedure you're looking to undergo, who does it on a regular basis. So what's regular? I think it just depends on the complexity of the procedure, but facelift surgery is actually a complicated operation, just like rhinoplasty. Facelift surgery can be done in a number of different ways. Now, there's going to be a range. There's going to be some easy cases where a patient requires very little work to be done to look great, whereas some people may have very tricky anatomy and need sort of expert skills to really provide the best outcome. And furthermore, you know, there are patients undergoing other treatments like filler injections, biostimulants, energy devices. All of these things can compound the complexity of the operation, really making it that it's essential to undergo the procedure by an expert, someone who does the operation frequently, who's encountered some of these sort of complex factors that may make the surgery less predictable.
So when somebody comes to you for a facelift consultation, when you're looking at them, what are you looking for? Because the surgeon's opinion about who he wants to take on is just as important as the patient who chooses their surgeon. So what makes for a more straightforward case? What makes for a complex case? And how do you know if the person is a good match for your practice and for you? Because you get into a relationship with a patient, it's like a marriage. And once you start doing work with them, then you're in a relationship that is ongoing for quite some time.
Sure. Well, it's a good question. I think this is one of the most important questions in all of facial plastic surgery, picking a patient and patients picking a surgeon. So when we're looking at a patient for the procedure, there's the physical factors and then there's the emotional and psychological factors. A happy patient is someone who we're able to reach or exceed their expectations. So if we provide an operation on someone who is crazy, unrealistic expectations, no matter how good the surgical outcome is, we may think it's amazing and want to share the results with you guys or with other colleagues or present it at a conference. But if the patient's expectations are not met, they're going to be not happy with the results. So we're trying to gauge whether the expectations are reasonable, real, and whether we think as surgeons that we can meet or exceed the expectations. So I think that's sort of the way I look at it. Is then there's the physical factors. So physical factors that can relate to the surgical outcome: age, tissue type, skin type, ethnicity. I mean, there's so many variables that go into it. But if someone's taking really good care of themselves, if they're lean, if they're fit, if their mind and body and everything sort of optimized, then often the surgical experience will be very straightforward. In patients who've had a long history of, not
Smoking?
taking care of themselves, smoking, tons of sun damage, no matter what we do surgically, we may have sort of limitations as to what we can achieve. And it may require not just surgery, it may require surgery plus other stuff, biostimulants, laser energy devices to improve their skin quality even after the lifting procedure is carried out.
So, I mean, we often talk about the different anatomy when we're doing consultations. Somebody who's got, I will use my face as an example. So someone like who's got thinner skin, who's more lean, I don't have a lot of neck. I'm considered an easier candidate for facelift surgery, correct? Opposed to somebody who's got more thick skin and heavy gels that maybe used to be up here, the fat pads, and they've sort of fallen along the jawline. More dense neck, that's a little bit more of a challenging case, plus biostimulators, which we'll also talk about.
Yeah, so physically, I don't know about your mental state, but physically, yes, you're physically you're a good candidate. Yeah, you're
Unfiltered.
You're healthy. You're lean, and your anatomy looks like it'd be easy to reposition. Some people, you actually go along their jawline and go like this, like someone like you, and that's what you want, right? It's very easy, and so surgically, similarly, would be straightforward. But some people have very, very thick necks. Their anatomy is such that they may have a small chin. Their hyoid, which is a bone down in the neck, may be in a suboptimal position, really low down. So they have what's called an obtuse cervicomental angle.
Like this angle.
That angle maybe sort of, even when they were young, may have not been ideal.
Yeah.
And they may want you to create as much of a swan neck as possible. Some people also have anatomy where their salivary glands have fallen down. And
You can sort of see them sitting here a little.
Yeah, you can see them on the side. And there's been a bit of an attention drawn to the fact that some people can get more contour by trimming those glands. And that's something that we sometimes feel there's a need to do. It's got a bit of there's been a bit of a trend, probably just like many trends.
People ask about that a lot.
Overdone a little bit, but certainly it is one of the things that we take into consideration when we're reshaping the neck and jawline. So,
Question for you. Does the chin shrink, recede as we age? Because we
Yes.
often say, sometimes people need a little bit more structure here because I used to have more jawline. We do get that question a lot.
yeah, so I mean, everything does change with age, including the facial skeleton. So the jaw and the bony anatomy is going to resorb. There's been some studies with CAT scans showing patients' facial bones sort of as they age, and it
would be
varies
interesting to see.
varies amongst people. So it's not just the soft tissue falling down, but you're also getting a bit of shrinkage.
Yeah. Well, I guess like osteoporosis, we shrink a little, right? All over the place.
Yeah, we shrink a little bit everywhere. So in some cases where patients' anatomy is such that they have a small chin to start with, they've noticed it shrink even further, and they're asking us to give as much improvement as possible. We may recommend not just a lift, but also a potential chin implant as well.
So when is it the right time to do a facelift? I think we get this question a lot because, now we have a younger demographic that's more self-conscious of what they look like. They notice signs of aging at a much younger age than they probably ever did before. So when is the best time? Is it in your 40s? Is it in your 50s? Is it in your 60s? How do people decide?
I think the decisions on all these things is still in evolution, but I think there has been a generalized acceptance and trend to do the procedures at an earlier stage than we used to. So in the old days, we would, when I trained, it was sort of like an operation that was carried out on patients in their mid-60s, early to mid-60s, where people really were starting to notice significant signs of aging, where their necks and their jawline were looking just dramatically older. Nowadays, people are trying to nip it in the back and not yo-yo. They don't want to start looking older and then younger again. So people start doing interventions at a younger age, from non-surgical treatments and then smaller surgical procedures. And there's been a general acceptance now to do procedures such as a facelift or a mini facelift as early as in your mid to late 40s. And I'd say that's actually become quite a common procedure that we do. Mid to late 40s to early 50s often is sort of the best results we get from facelifts. And then there's the idea of what's a mini, some of it's just terminology. Yeah. Mini just refers to the length of the scar. So when patients are undergoing procedures that are just limited to the face part of the procedure, a mini or a short scar facelift may be adequate if their neck is really good to start with. In patients in their 50s, more often than not, we have to do a conventional facelift incision to elevate the neck and the jawline and the midface, so that you're dealing with the soft tissues of the cheek, the nasolabial folds, the jawline, and the neck.
I was just going to say, what does the facelift accomplish? Because some people come thinking, okay, I don't want to do any more Botox or filler. I don't want to do anything else. I want to look younger, and I don't want to be coming back and doing things over and over again. So I want a facelift. But the facelift, like anything else, it does its job, and its job is to, as you said, lift soft tissue. It doesn't get rid of this completely. It doesn't do this completely. Like, it doesn't do everything. So you always say we have a toolbox. So let's talk about the toolbox to help accessorize with the facelift.
Yeah, I think a good way to think of it is a toolbox, surgery being the main tool, and then there's other tools. The other tools that we use frequently are energy devices, fat grafting, filler, biostimulators. So surgery is the main tool. And, there was a huge movement towards doing non-surgical treatments in patients into their late 40s to avoid facelift surgery. It was called liquid facelift, things like that, some terms that were very, very commonly being pushed forward in marketing by specifically the filler companies. Liquid facelifts was sort of a descriptor, but it wasn't a real, it didn't match up with what was actually being done. It was using filler as a camouflager instead of getting surgical intervention. The problem is that it was not restorative. It was filler as a camouflager. So, as you age, it descends. And by adding volume, it can inflate and it can give the illusion as if you've undergone a lift. But is it really lifting? We don't really believe that it's lifting very much. It's rather inflating. So for some patients, facial anatomy, where they're very, very lean and you can use a little bit of volume as a camouflager, and maybe a great tool, but it's not restoring, it's changing the look. So some people look very different. They may look attractive, but different attractive. Mm-hmm. Whereas facelift surgery, you're actually restoring, you're putting it back to how you were. So if you like the way you looked when you were in your 30s, the facelift procedure is going to attempt to, rejuvenate you back to where you started. Doesn't mean you can't do fillers and things like that also to enhance some of the results, but to use fillers as the only tool in lieu of a facelift, like a liquid facelift, you're really going to be changing someone's anatomy significantly. And we see that. We do a lot of filler in our practice where people are building up the jaw lines, building up the cheeks, filling in the temples. People can have 10 vials of filler in and they may look pretty good, but they may look different. And they may start looking like their facial shape looks very, very different than if you go back and look at photos of when they were younger. Whereas the surgical intervention, even though it's more invasive, is actually much more natural and restorative in nature.
So are you more comfortable, would you say, to do a facelift on a younger person now, so that you sort of take them down the path of rejuvenation rather than the path of sort of changing a little bit of what they look like? When do you make that decision of when it's time to do surgery?
As a surgeon, people are coming here for surgery. So, for us, the patients have often made the decision just by making the decision to come see us. They've often exhausted all the other things. They've done all the fillers. They've done some energy devices. Frequently, they've been okay for a while. Now they're hitting the wall where they feel like they're not quite happy with the results that they're getting from some of those alternative treatments. In fact, some people are overdoing it and getting water retention. They get what's called filler fatigue, and that's often pushing them to go consider a surgical intervention. I think most people, if they actually were willing to do the surgery, most people conceptually understand that would probably give them a more natural, better result. It's just that there's obviously the fear involved with undergoing the surgical procedure, which is understandable. It is a bit more to take on than just undergoing an injection of filler.
So which is better for you? A patient that comes to you late 50s, early 60s, they've had different microneedling treatments, they've had biostimulators, which can sort of maybe possibly compromise the tissue, or would you rather see a virgin patient who's never really done much filler, much biostimulators, many microneedling treatments? Which is a better candidate for you? Which way do you think people should go?
The surgery is easier if the patients had less done. There's no question about it. Working on virginal tissue, the tissue planes are preserved. It's easier to see, to deliver the natural, beautiful surgical results when someone's had nothing done other than Botox and maybe a little bit of filler. But once they start getting into a lot of energy devices like Althera, ultrasound waves to heat up the tissue, soft wave, ultrasound waves to heat up the tissue, a lot of microneedling devices, certain biostimulators like Sculptra. The tissue planes are harder to work with. And we've had recently a few patients that had undergone a lot, like they were very invested in anti-aging, but their surgery was much, much more difficult because we were working through a lot of scar tissue.
But it can still be successful.
No, absolutely. It's not that you can't undergo surgical intervention. And many of the patients who've invested in the non-surgical stuff are the most committed and motivated to do the surgical stuff. They were just trying to buy time.
Okay, so let's say patients start in their 40s, early 40s, having a facelift. How much time does that buy them? How many facelifts can somebody do in a lifetime?
I think in general with aesthetic medicine, there's no absolute numbers or rules. We sometimes push the envelope a little bit. Like we've had patients come back that I've done a facelift for them. I've been in practice now for 25 years, I think. So
yep, you're at 25. Congratulations.
Yeah, we had patients come see us last week that we did a rhinoplasty, I think, 18 years ago, just for follow-up to check in. We had a facelift that we redid, two patients we did facelifts the last few weeks that I'd done a previous facelift 7 to 10 years ago, and they came in for another one while they're still healthy in their 70s. So that's and some are approaching their 80s. So as long as patients are healthy and if we can identify things that we can improve, if the surgical intervention's warranted, I think it's reasonable to do. If it can enhance patients' sense of self and that they feel good about the procedure. So it's very rewarding. I don't feel
that was my next question.
I don't feel like there's it's rewarding. It's not really an age thing anymore. Look, you could do a facelift at 80 and live to 100 and feel like you had a better neck for 20 years. So it's we don't want to be ageist, I guess.
Well, you just did a facelift this week on a patient, I believe 76 years old. Her jawline looked like she's in her 30s. Unreal. Chiseled, unreal. That was quite something. A 76-year-old woman.
And we did her 7 to 10 years ago, the first time, right?
Yeah.
Yeah, Matt, it's funny because with the newer technique that I'm doing with the deep plane extended lift, I felt like I improved her jawline more after this operation than I did when she did the operation in her 60s with the more conventional facelift at that time.
Which goes to show you how that line about how many hours you put into any field that you're in, you become even a greater expert with time. I mean,
I think so.
You're always evolving.
I think you're evolving as long as you're invested in evolving. Some people start their career doing X and they do 10,000 hours of X and they don't really evolve. So you have to have an open mind. Like we are all sort of invested in improving ourselves. Some of the best people in the field of aesthetic medicine, I mean, there are some older guys that I follow sort of on social media, or I've seen them at lectures and conferences over decades. And there's a few guys in particular who just seem to be constantly evolving and adopting and taking on stuff that you have to have an open mind. In rhinoplasty, there was a surgeon who wrote multi-volume textbooks who just apparently switched his technique in the last few years. So it does, your perspectives do change.
The last thing I'm going to touch on is after facelift surgery. What do people do to maintain the results? I mean, we always say just because you did the facelift, doesn't mean you don't have to do anything. We always say good skincare routine, super important because you want to maintain the health of your skin because your skin gives away a lot. We see microneedling treatments. What else would you recommend for people who've had a facelift to keep those results?
Well, I think, we offer so many different services at our clinic, partially because we believe in this concept of 1 + 1 + 1 = 10. So what do I mean by that? 1 would be the surgical sort of paradigm. That's 1. 2 would be the Botox injectables paradigm. And then the 3rd would be energy devices. So if you add up all 3 of those together, that's the best way of getting closer to being a 10 out of 10 in terms of what you can offer people. So people need to have an open mind, consider surgical intervention, energy devices, filler and Botox or fat grafting for volumizing and maintaining your skin quality, and that's how you can get a 10. Anyway, that's it for this episode. I hope you guys got something out of it, and we'll see you soon.